Welcome to Canada, a country known for its diversity, excellent healthcare, and boundless opportunities. If you're an internationally educated nurse, IEN, looking to practice in Ontario, you're in the right place. In this video, we will guide you through every step to becoming a nurse in Ontario, ensuring that your transition is smooth, clear, and exciting. Let's begin your journey to becoming a registered nurse, RN, or Registered Practical Nurse, RPN, in Ontario. The College of Nurses of Ontario, also known as CNO, is the regulatory body for nurses in Ontario. Its role is to ensure that every nurse meets the highest standards of competence, ethics, and patient safety. In Ontario, nursing is a self-regulated profession, meaning that nurses have the privilege and responsibility to uphold professional standards to protect public safety. Now, let's find out if you are eligible to register with the CNO. If you have completed your nursing education outside Canada and are not already registered as a nurse in another Canadian province, you must go through the CNO registration process. However, if you have a medical degree in another profession, such as midwifery or paramedics, this will not be accepted as a nursing qualification in Ontario. Now, let's take a look at the 4 key steps to becoming a registered nurse in Ontario. Your path to becoming a nurse in Ontario involves 4 key steps: applying through NNAS, submitting your application to CNO, meeting registration requirements, and completing final licensing. Your first step is to apply to the National Nursing Assessment Service, NNAS. This organization evaluates your education and experience based on Canadian nursing standards. Once your documents are verified, NNAS will send a report to CNO, allowing you to proceed to the next step. After receiving your NNAS report, you must create an account on CNO's online portal and submit your application along with the necessary fees. To qualify for registration, you must meet these key requirements. Nursing education must align with Ontario's standards. Evidence of practice, proof of nursing practice within the last 3 years. Registration exam, pass NCLEX-RN for RNs, or REX-PN for RPNs. Jurisprudence exam, tests knowledge of Ontario's nursing laws. Language proficiency, IELTS 7.0+, CELBAN CLB 10, or TEF Canada B2+. Criminal record check, must be recent, valid for 6 months. Once all requirements are met, you can complete your final registration online and start your career as a licensed nurse in Ontario. Congratulations. Welcome to Ontario's healthcare system. Visit www.cno.org for more details.